In this video, I'm going to be explaining how to cure dry eyes, and we're going to do that by explaining the 7 most effective dry eye treatments. So whether you're looking for a home remedy, something that's available over the counter, or if you're looking for something that's like an in-office treatment with your doctor, such as medications, then we're going to be going over all of that. And this might be the most comprehensive live education about dry eyes that's available right now. So thank you so much for joining us. Whether you're somebody who's just starting on your dry eye journey just with mild symptoms, or if you're somebody with severe chronic symptoms for dry eyes or something known as keratoconjunctivitis sicca, then I think you're going to get a lot out of this. Now, if this is the first time we're meeting, I am Dr. Joseph Allen. I'm a practicing optometrist here in the state of Minnesota and the host here on Dr. Eye Health, the channel that helps you learn about the eyes, vision, and finding the best vision products. And that's really just because we want you to keep your eyesight the best for today as well as for tomorrow. So if you're new to the channel, I really encourage you to go ahead and subscribe. So you can subscribe by clicking that button down below, ring the bell, and turn on notifications so that you don't miss any of my future videos. Now, I want to take just a moment to say hi to a few people in the chat. We got Ravana and Neer, thank you so much. Tudor, thank you so much for joining us here. It means a lot. Wherever you guys are joining in from, go ahead and comment. I'd love to know where you guys are at. Otherwise, we got a lot of stuff to cover, so let's just jump right into it. So again, we're talking about different treatments for dry eyes, and the first #1 treatment, you guys might laugh at this, but it is artificial tears. So lubricating eye drops is actually at the top of the list for a major reason. And you may be thinking, whoa, Dr. Allen, artificial tears, you're just blowing me out of the water with this new technology. But no, artificial tears is actually a major component to all dry eye treatment management. So whether you have mild dry eyes or really severe chronic dry eyes, if you read the Dry Eye Workshop 2, the DEWS 2 report, which is a major report of some of the brightest minds in all of eye care, reading the best research, they kind of laid out the most modern treatment for diagnosis, management of dry eyes. And in that, from mild to severe, artificial tears is in all of those treatment designs. So one of the big issues, so I had a patient even today who said, I still got dry eyes, it's been a few years, and she's like, I'm like, where are your drops? Oh, they're in my purse, but I never use them. Well, that's kind of the problem. So the big issue, it's not just that artificial tears add lubrication to the eye, but they actually help prevent damage to the surface of the eye from chronic dryness. So in the clinic, we actually use a yellow medication called fluorescein sodium, and we put that on the eye. You can actually see these little dry spots on the eye. So if you look here in this photo, there's these little dry spots off to the side. Those are actually like little tiny divots on the surface of the eye. So the eye should be smooth like glass. When they're really dry, those cells on the surface of the eye actually get damaged. And we call that superficial punctate keratitis. So the superficial punctate keratitis is basically dead cells caused by this dryness on the surface. And the body tries to heal those damaged cells with inflammation. Now, the problem is that when the eye starts having inflammation, it's like adding gasoline to a fire. It often makes things worse. So one of the big things about using those dry eye drops or artificial tears is to prevent inflammation from really grabbing hold and making things worse. So if your doctor has prescribed to you, hey, start using artificial tears of a certain brand this often, you want to do that. I encourage you to go ahead and follow their instructions. You will notice an improvement, or at least help control this inflammation from getting worse. Now, some people, your inflammation may be too far gone, and so you may need other treatments, and that's why we're talking about this here today. Now, in terms of just artificial tears, there's a whole long discussion on that, but I have made another video on artificial tears. I've included that in the description below if you want to check that out. Lots of different eye drops. Now, the big thing I do want to comment on is whether it's preserved or not. So this is an example of a non-preserved artificial tear. If you're using artificial tears more than 4 to 6 times a day, most doctors will recommend a non-preserved tear because otherwise, if you're using it a long time, a lot of times throughout the day, preservatives can actually hurt the eye, cause more kind of allergic reactions to those preservatives. So non-preserved drops often are ideal. Now, let's say you're somebody you're doing artificial tears and it's maybe not enough. Maybe you already have a lot of inflammation on the eye. Your doctor will actually discuss another treatment. And so this is the second most common treatment I see a lot of doctors talking about, and that is omega-3s. Now, omega-3 fatty acids, if you've never heard of them before, omega-3s have a very strong, potent anti-inflammatory effect. And this can affect so many different things throughout the body. And I think a lot of doctors recommend it because omega-3s help so many things in the body. And honestly, the omega-3s in artificial tears, they're usually a lot cheaper and affordable than a lot of the other medications or in-office treatments for dry eyes. So it's a good place to start. Now, omega-3s, they come in fish oils, they come in flaxseed versions, algae-based versions as well. Now, most of the studies done on dry eye were all done mainly on the fish oil supplements. So omega-3 supplements from fish oil. And a lot of these studies do show improved signs and symptoms of dry eye when taking these omega-3 supplements for about 60 to 90 days. You do need to be taking a higher amount of milligrams of omega-3 to see that benefit. I've been to large panel discussions with a lot of doctors, and some of the best, brightest minds about omega-3s will kind of argue between how many milligrams really need to be used to see the best clinical benefit. But most of the published studies that I've read are around 2,000 milligrams or a little bit more. Now, I personally do take omega-3s. These as a PRN brand, that's a brand that I like to take because they're a lot more higher quality. If you do your research, you'll find they're a lot higher quality than things you'd find at like the grocery store or other pharmacies. They do only sell them either online through their own web store or from a doctor's office. There is a lot of information on their website, and I've included more information about that below. But a quick comment for anybody who's maybe thinking about starting an omega-3 or any supplement, I think it's important to talk to either your eye doctor or talk to your family physician to make sure that there's no other potential complications. A lot of supplements out there, you don't know exactly what's in them. They may interact with medication you might be already be taking or with something else, maybe a medical condition you have. And I think it's just your best all-around go-to to make sure you talk with them before starting any supplement. Now, let's talk about the next sort of treatment. So beyond omega-3s, I think the first one, artificial tears and omega-3s, again, are excellent for most people, especially if you don't like taking medications or if you maybe don't have all the resources financially to talk about medications. Now, for most doctors, including myself, we're trained medically to prescribe medications, to know the side effects and what's going to work, what's not. So medicated eye drops, there actually are some great medicated eye drops out there that work great for dry eyes. So the two biggest dry eye medications that are out there, there's one called Xiidra and another one called Restasis. Now, I got a couple of examples. These are actually expired samples from our clinic. So Restasis has been out for a long time. That's the brand name. And Restasis it works great. Both drops are used, one drop twice a day, both eyes. Now, Restasis, it works by helping control some inflammation on the eye, specifically the inflammatory cascade that sends the inflammation basically to the lacrimal gland, and that prevents tears from basically being produced. Now, what's great was that Restasis will help block that inflammatory cycle, and you actually start producing your own natural tears again. The biggest downside to Restasis beyond cost is the fact that it does take some time because those inflammatory cells have already attached to your lacrimal gland, and it takes some time for those cells to degrade and release. So people who are on Restasis basically need to be on it for at least 3 months, using the drop twice a day for 3 months in both eyes to see a clinical benefit. Sometimes you have to be on it for up to 6 months. So that's the downside to Restasis. But overall, I see a lot of people have good success with it. I have a patient who came recently in because she'd been on it for 3 months, and even her friends said, "Hey, your eyes aren't as red anymore." And she was just like, she came in for a follow-up, and she was like, "I have dry, red eyes that I've had for like all my life." And her friends finally noticed, "Hey, your eyes aren't as red," and she was knowing they're not as dry anymore, so it is good. Now, I'm not sponsored by any pharmaceutical company. I'm just talking about what I actually see works in the clinic and what other doctors are using to prescribe and help people out with dry eyes. Another one is called Xiidra. This one is basically the competitor Restasis, although they are not the same mechanism of action. Xiidra also reduces inflammation on the eye, still twice a day eye drop for dry eyes. Now, Xiidra actually has the nice benefit of it working a little faster. Clinical studies have actually shown that people have improved signs and symptoms. So signs like what the doctor sees for dryness, that'll improve, as well as the actual like dryness symptoms that the patient has. So great studies, and they show that as soon as 6 weeks. So if you don't want to wait as long as 3 to 6 months as Restasis, maybe Xiidra is better for you, except that's a decision that you need to discuss with your doctor, because depending on the type of dry eye you have, the signs and symptoms, one of these drops may be better for you than the other. So, hey guys, I know this is a lot so much so far. We've like been going over a whole lot of stuff, and I'm sorry if I'm just throwing this stuff at you and you're getting overwhelmed. You can always come back to this video and rewatch it, but there's a lot of information I want to cover. But if you're liking this content, you like learning about dry eyes, you like learning your doctor's perspective about dry eyes and dry eye treatment, give me a thumbs up. Hit that like button for me. It's going to tell me that you guys like this information and that you want to kind of learn this more information. Thank you guys so much for joining. Just want to say hey to, we got Oni, we got Jay He, Tudor, Joseph. Thank you guys so much. One guy saying, Ray Miller saying, I'm the best engineer. And I'm personally not an engineer, but I know when I wasn't going to school, I was actually thinking, you know, if I wasn't going to be in eye care, I probably would have been an engineer. So that's kind of cool. Thank you for sharing that. Now let's kind of talk about the next topic. Now, and that one's really a big topic. These are new technologies coming out for dry eyes. These are in-office treatments. So these are treatments that you can get in the office with your eye doctor, and not every office will have these. But these are kind of newer treatments that are coming out. And so especially if you have a dry eye specialty clinic, sometimes refractive surgery clinics will have these because they want to control the dryness on the surface of the eye before they do things like LASIK or cataract surgery. One of the biggest ones, and this is one that I've actually had completed on my own eyes, and this one's called Lipiflow. So if you've ever heard of Lipiflow, go ahead and comment, let me know, or maybe you've had it already, tell me to let us know what you think of it. So if you've never heard of Lipiflow, this is what Lipiflow looks like. So this is actually a device that goes on the eye, and it actually supplies heat and pressure to your eyelids. And the whole point of that is actually to get the oil glands in the meibomian glands to release. So I had another video the other week about meibomian gland dysfunction. If you don't know what the meibomian glands are, they're these little vertical glands that run on the top and bottom portion of your eyelids, and they actually secrete this oil that prevents your tears from evaporating. Now, the real concern is that these oil glands eventually will die off if they get clogged or they become inflamed and they don't work anymore, and then your tears evaporate almost instantly. So these are some great photos. And then to kind of show you what we see in the clinic, I'll switch it on over. This photo here on one side shows functioning oil glands that when you put a little pressure to these oil glands, you can see the oil come out. Where somebody who has the oil glands that are basically dead or not functioning, these oil glands are completely gone. So you can put pressure on there, no oil's coming out. And so again, these office treatments like the Lipiflow can help get these oil glands to open up and secrete. And so if that doesn't happen, these oil glands can actually die off. So you can see in the middle here, these oil glands, they kind of look like little train tracks or little grapeseed clusters. Those glands are dead in the middle. They're not coming back. And so the point is that if you have these damaged oil glands or the oil glands are blocked up, using a Lipiflow device to heat those oil glands and get them to secrete, basically squeeze out all of that oil, then they'll start producing again. So that basically works by this device being put on the eye. It heats the oil glands from both directions, and then it actually does this little pumping mechanism to get the oil glands to secrete. It sounds painful, but it actually is not. I actually found it very comforting. It actually, the heat feels good. It goes on for about 12 minutes at a time. And it actually, you can feel it kind of put some pressure there, but it's not really on the eye, it's just on the eyelids. And especially if you have these blocked oil glands, they really do help. Now there's another treatment beyond Lipiflow that's kind of newer. It's called the iLux, and this is one that I think I haven't had it done myself, but I've actually seen the device, I've tested it out, and this is a similar kind of theory. Applies heat, but this one applies heat through light. Light that's shined on the eye increases the temperature of the oil glands, and then again it does a pumping mechanism And that pumping mechanism gets those new loosened oils to secrete out of the eyelids. Now again, you have a lot of issues with dry eyes, and you have inflammation from oil glands issues, chronic dryness, blepharitis, things like that. If you have chronic dry eyes, a newer treatment, this is something that I actually do in the clinic, is something called an amniotic membrane. And go ahead and let me know if you've ever heard of amniotic membranes before. It's kind of a newer treatment overall. These are some of the amniotic these are dry, dehydrated amniotic tissues that we have in the clinic. We also have frozen amniotic tissues. We use these for people who have bad chronic burns on the eye, people who have any sort of bad tissue damage to the cornea. This amniotic tissue is fantastic. It adds a lot of different antibodies to the eye. It is harvested from a pregnant woman's amniotic sac. It's cleaned, sterilized, and then it's either frozen or dehydrated, and we can put that on the cornea for a short time, and it helps pretty much clear off a lot of inflammation from the surface of the eye. And so it's kind of like hitting a reset button for people with really chronic, severe dryness. So a quick question out here from Blue Green. She kind of wondering if insurance covers treatments like these. Amniotics, amniotics is questionable. Depends on your insurance. They may cover it, they may not. If you have a deductible, of course, it'll probably go toward that. If you have a Lipiflow or an Ilux, at the moment, I'm not aware of any insurance that covers those sort of treatments, but oftentimes they are really needed. So that's a really good question. Another one, then this one I think actually is covered by most insurances, is one that's been around for a lot longer, and those are called punctal plugs. So punctal plugs work because they literally plug, they're either made of collagen, or they're made from silicone, and they're literal plugs that we put in the drainage canal of the eye. And the goal of putting these plugs in the drainage canal is to prevent the tears from really draining down the canal into your nose. So if you're producing an adequate amount of tears, or maybe you're not producing enough tears, but we can plug the drainage canal so that the tears rest longer on the eye, then you're not going to be as symptomatic. The big issue, and why a lot of doctors may not be using punctal plugs as much, is that this whole concept of inflammation on the surface of the eye. If you have a lot of inflammation, then the inflammation, if you plug up the drain, all that inflammation sits on the eye. It's kind of like a dirty sink. If you plug up the dirty sink, all the garbage in the sink is going to sit there and fester. So you got to let that sink drain out, clean out the sink first, whether it's medication, whether it's one of the treatments like Lipiflow or Ilux, then you can go ahead and put a punctal plug in. So I still use punctal plugs in the clinic. I think they work great for a lot of people, but again, you got to make sure you control the inflammation first. Again, I want to say hey to people in the chat. Thanks so much for just kind of leaving some comments. I see a couple of questions. We'll hopefully get to those soon. Again, we're talking about dry eye treatments and some of the best ones that are out there. Now, again, we're talking about using Lipiflow and Ilux that heat up those oil glands to the eye, those meibomian glands. That's really important. So I know a lot of people, if you have a Lipiflow or an Ilux done, one of the big things that your doctors usually talk about is, again, taking omega-3s to control the inflammation, but then they'll talk about warm compresses. And I've got a lot of videos talking about warm compresses, reviewing different warm compresses that are available. Warm compresses basically is kind of the daily at-home treatment for treating those meibomian glands that are blocked up, because that heat will melt those oil glands again that are been solidified, and then you can do a gentle eyelid massage to get them to secrete out. And this is something that you can, there's so many different warm compresses on the market. I personally have always been a big fan of the Brooder mask. There's a couple other ones that work really well. I think the big thing about them is just that, you want to find something that you can reuse, that's easy, convenient. There's a couple of cool methods I've actually heard from other people commenting in the videos. I think it's actually pretty cool, all the different things people have come up with. But I know just for convenience, the Brooder mask is what we offer in our clinic. It's something that's washable and it's really cool. Again, with all these things I'm talking about, I do include those in the description below if you want to check out more about those. Now, we're getting close here, guys. We only got a couple left. Now, the next one is called Autologous serum. Now, this one a lot of people may have not heard about before. So go ahead and let me know if you've ever heard Autologous serum, yes or no. Autologous serum, it's actually been out for some time, but it's not used as frequently as I think people should. But it's basically where they do a blood draw. You actually need your doctor to write a prescription to send you to the phlebotomist to do a blood draw. They actually centrifuge your separated blood. It's basically separating your plasma from your blood cells. And that's the easiest way to think about it. They're actually making artificial tears, liquid artificial tears from your own blood, antibodies, all the white, you basically separate the blood cells. So you're just using basically the plasma of the eye. And you actually put your plasma of your blood and you use that as an artificial tear. And that has some great advantages because it helps your body's own immune system fight off the dryness. The downside is, again, you need a prescription. You need to go to the pharmacy and go to the phlebotomist, get it drawn. They have to prepare it, and not every pharmacy or phlebotomist will do this. Not every lab will do this, so your doctor has to find a lab that does it. And I think that's one of the reasons why a lot of doctors don't prescribe it. We have a couple places here in Minnesota, so we will do it. And this is more for people with really severe dry eyes, people who have already tried most of the other treatments we've talked about before. This is one of the kind of the end stage ones a lot of people will go to. But for a lot of people, it's great. That works really well. Now, beyond autologous serum, there's one left. And this is the one that I find is kind of, again, maybe not the last stage, but for a lot of people, it helps a tremendous amount. And it sounds kind of counterintuitive because I bet a lot of you out there who wear contacts have dry eyes. But scleral contact lenses are an excellent treatment for dry eyes, as long as you're able to put them in, take them out safely. Scleral lenses is kind of they're kind of coming back into how you can treat. You can treat a lot of things with scleral lenses, certainly keratoconus, but also dry eyes. If you've never heard of scleral contacts, they're really large contact lenses. This is a picture of a large scleral contact lens. It kind of looks like a little bowl, right? And basically you fill that bowl full of liquid and the contact lens kind of seals around the sclera, the white part of the eye, and holds that liquid to the surface of the eye so that basically the cornea is bathed in liquid all day long. Now, oftentimes people with severe dry eyes may have to take these out, refill the liquid, and replace it maybe a couple times a day. But in terms of a dry eye option, it's pretty cool. I mean, the fact that we're able to kind of use this technology, and scleral lenses have been around for a long time, but it's kind of come back and the new designs have come out, so it's really great. So yeah, that's what a scleral lens looks like. That's pretty huge, guys. Anyone here in the chat who wears scleral lenses, certainly let us know. So those are really my 7 favorite ways of treating dry eyes. Those are really some of the most advanced in-office treatments, medications that we can prescribe. There's certainly not every treatment that's available, but these are pretty much the most common ones and the ones that I find most effective. So let's go into some questions. You guys have any questions? There's a lot of good questions about dry eyes people will have. It's true that dry eye treatments will not help necessarily with cataracts or macular degeneration. They're affecting different parts of the eye. Cataract is the lens inside the eye. Macular degeneration is retinal disease in the far back of the eye. But it's true that dry eyes can affect your vision significantly. If you actually had no tears at all in your eye was 100% no moisture, you would lose about 70% of your vision, if not more. So it really plays an important role. I heard a story here from Jay He about getting shattered glass and broken phone screen in the eye. That stinks, man. That's got to be really painful. As far as magnesium eye drops for inflammation, I've never really heard of magnesium eye drops specifically. I'll have to do some research on that. Material of the plugs. Yes, there's different types of plugs that are available. Different brands will have them. In the most part, there's collagen plugs, which are actually most often porcine. So they're made from pig collagen. Wait, did I say porcine? Yeah. No, you have me confused. No, porcine is pigs, bovine is cow. But yes, porcine collagen, those are temporary plugs. They usually dissolve within within the first week or so. But they're good for temporary for us to test if it's something that's actually going to work for you. And then we can use silicone plugs, which are more permanent. And most people don't have any allergies to silicone. Certainly, Lumify can help get rid of red eyes. Thank you, Andy. Lumify helps by constricting the blood vessels on the eye. It is one of the safer drops that came out recently rather than some of the other kind of get the red out drops that are available. The biggest concern about like get the red out drops is that you could be masking something else that could be going on the eye that may need to be treated with medications or other form of treatment. And then people who chronically use get the red out drops, often they have this rebound effect, which makes things worse and worse and becomes almost like an addiction. You have to keep using the drop over and over and over again. Is it okay to use drops more than twice a day for dry eye? It's an amazing question. Thank you so much, Blue Green. Yes, certainly artificial tears. I always say, make sure you talk with your doctor, your eye care professional that you see. If they recommend twice a day, use it twice a day. If they're recommending 4 times a day, use it 4 times a day. Some people may need to use drops more often, and that's when you want to be going to a non-preserved artificial tear. So yeah, this is great. Well, guys, thanks so much for joining me in the chat. Hope you enjoyed the video. If you liked the video, give me a thumbs up. If you haven't subscribed to the channel, you're new here, make sure to subscribe to the channel so you don't miss any of my future videos. Guys, thanks so much for joining me. Again, if you want to check out other cool videos from Dr. Eye Health, we got a good collection of different videos for you to view. I want to leave you guys with kind of just an eye health question of the day. So eye health question of the day, guys, what of the 7 treatments that we discussed here, and I know the 4th treatment included a lot of in-office treatments, but which one do you think is most exciting, something you've never heard about? Go ahead and comment, share in the comment section below. Otherwise, guys, thanks so much for watching. If you'd like to see other cool videos from Dr. Eye Health, please go ahead and click or tap the screen over here to the side. Or if you'd like to see another cool video from Dr. Eye Health, go ahead and click or tap the screen over here. Again, this is Dr. Joe Allen here from Dr. Eye Health. Thank you for watching. Keep an eye on it. We'll talk to you soon.